Hello, everyone. I hope you're doing well and everything is fine with you. The purpose of this session is to gain experience from those candidates who have cleared the practical exam and have finished their ADC journey. And these sessions help you gain exam experience and their preparation strategies. All right. So feel free to ask questions from them in regards to the preparation, especially those candidates who are planning to sit for the practical exam in the next months, so that you can gain valuable experience on how they prepared themselves and how they went about on the day of the practical exam itself. All right. So we had a very good month. We had 13 candidates who did clear the practical exam. And we had, I think, Dr. Ravi, Dr. Arun, Dr. Thomas, Dr. Pooja Jagtiani, who recently cleared 2 days ago, in fact. And then we had Dr. Ishrat, Dr. Sara, Dr. Ravi. Um, I think then that we had two candidates from Egypt, Dr. Rana and Dr. Ahmad Masood, who cleared the practical exam. Unfortunately, a lot of them were not able to make it today, of course, because of the time difference, and it's Saturday working days in most of the Middle East countries. But we managed to get hold of Dr. Ishrat. I hope, Dr. Ishrat, are you in the meeting?
Yes, sir. Yeah.
All right. So we are going to get started with you. All right. I'll have a few questions from my side to help the candidates navigate this journey, and then your input in regards to those questions will be very important. All right. So if anyone has any particular question that they would like to ask, they can always leave it in the chat section. And once we are done with the questioning part with Dr. Ishrat, she or me will be able to answer those questions. All right. Okay, so let's get started. Dr. Ishrat, first of all, congratulations on clearing the ADC exam. I believe you are based in Sydney, right?
No, sir. Melbourne.
You're in Melbourne. All right, that's
Yeah.
good. What have you done so far, or you're still in the excitement phase?
Actually, now I've come to India. I actually gave my exam and then come to India, and I got my
Mhm.
results when I was here. So now I'm in a phase of studying for PT and
Okay.
applying for APRA.
I think PT would not be tough. It's very easy booking. It happens almost every week, isn't it?
Yes, sir.
Yeah, and it's a totally computer-based exam, so I think that's the least of the hassle that you need to worry about once you have cleared the
Mhm.
ADC. Everything seems to be easy in front of it, isn't it?
Yes, sir.
All right. Okay, that's good. So you plan to then, once you get the APRA registration, then you plan to start working in Melbourne, hopefully, right?
Yes, sir.
And have you sought something out?
Actually, like since I was just worried because like 4 years of gap, and I was worried whether I would be able to, start practicing. So I've
Mhm.
just spoke to few people who are ready to mentor me initially,
Mhm.
and then like simultaneously work as well.
Mhm.
But yeah, I mean, we are in talk, so they're happy to wait for my registration as well.
Okay, all right. Well, 4 years won't make a much of a difference, all right.
Mhm.
Initially, I would say try to go easy on yourself.
Mhm.
Don't just start doing implants, especially with these ADC
Okay.
candidates that I see.
Mhm.
They say that let's start doing implants. Of course, it's very rewarding in Australia, but try to get hold of the things, the system, the coding, the item numbers. And once you get hold of that, things will be pretty much easier from that point onwards. All right.
Oh, okay, sir.
Make sure that you're competent enough in basic dental surgery, basic dental procedures. A lot of
Mhm.
candidates that we have, because I'm currently based in Perth, a lot of candidates that clear the exam, to tell you very frankly, they don't know how to do a basic class 2 filling. All right, which is a very sad part because, of course, ADC does not test your clinical skills, but they just want to, do extensive and invasive procedures. So make sure whatever you do, getting hold
Mhm.
of the invasive, extensive procedure, of course, is important, but try to make sure that you're well versed with basic dentistry because that's the bread and butter for you for the
Yeah.
next few years of your life. All right. Root
Yes.
canal treatments, scale and clean, extractions, get hold of surgical extractions. We get a lot of wisdom tooth extractions here. Root
Mhm.
canal procedures, especially for the posterior teeth, how to do a proper crown preparation, veneers preparation, get hold of Clear Connect, Invisalign. These are
Mm-hmm.
the procedures. Once you get hold of them, to tell you very frankly, you might not need anything else because you'll get so many patients in regards to these common procedures that we do day to day.
Mm-hmm.
All right. If you're
Sure.
able to do a good root canal, if you're able to do a good filling, the patient or the patient's family, the patient's relatives, or the patient's friends are going to come back to you. But please remember, if you're not able to do that, then it will be very hard. But of course, initially it takes time. It's good that you have certain mentoring options. Dr. Dipesh also offers that at their institute in Dental 101 for candidates who have cleared ADC. So you might get
Okay.
in contact with them as well. They have certain sessions that help you get into the practice. All right. This is
Okay.
true for candidates who are not practicing, who are based in Australia. Candidates who are from Arab countries, from Gulf countries, from Middle East, who are practicing in subcontinent as well, India, Pakistan, because they are currently so practicing so much. Once they clear the ADC exam, the transition phase for them is a bit easier because they are doing all these procedures there. They just need to be aware of the protocol, how the system works, how the coding works, how the item numbers are built. Other than that, it's a bit straightforward journey for them. But for candidates who are out of practice for a long time, once they clear the ADC, the initial transition phase is a bit tough, but it won't take you more than a month and two. So don't pick up cases that you are not confident about. All right. Learn to say no. That will be very rewarding for you at the end. All right. Do what you're comfortable with initially. And as you go along with this journey, you will get more confident and more comfortable doing other procedures as well. All right. And the journey is going to be very rewarding. Okay.
Okay, sir.
All
Yep.
right. So let's get back to ADC, the reason why we are here for this session today. So we'll get to know about your journey of ADC. How did you prepare for the exam? I believe you were with us with the written exam as well, right?
Yes, sir.
All right. So can you just briefly, not very extensive, just briefly tell everyone who is in the meeting, and of course those who are not able to make it, they requested me to provide the recordings to them. So
Mm-hmm.
yes, please just briefly let us know about your ADC journey and your preparation pathway.
Um, actually, this is not my first attempt that I cleared. For both
Hmm.
my written and my practical exams, I took one attempt for my written exam and
Hmm.
almost two attempts for my practical exam and cleared it in my third attempt.
Hmm.
Uh, Obviously, first written exam was a bit disappointing because I didn't expect to have not cleared, but then written exam is pretty much straightforward. So
Hmm.
whatever was there in your portal, I
Hmm.
just went through it, especially the ones that you had given frequently asked questions.
Hmm.
Those all the questions I practiced, and every day, whichever you used to post in Facebook group.
Hmm.
Was pretty much a month before exam. Like I used to
Hmm.
follow all those and study all that. That was pretty much enough for me to actually clear my written exam. I didn't even read much of articles and stuff. It was just the questions that you had given and the discussions that you used to conduct.
Hmm.
Regards to practical exam, again, your portal had everything.
Hmm.
And the only thing which I realized was in my first two attempts, it was like a practice for me. And it took that two attempts for me to understand what
Hmm.
actually ADC want. Because the first time when I went for the exam, what I thought was you just have to say exactly what is given in the portal, same to same. You just have to tell them.
Hmm.
I didn't understand the fact that they expect, they expect that the patient is convinced,
Hmm.
and they expect that all the queries of the patient is, clarified. But
Hmm.
which I didn't know, which probably, yeah, you told, but then I couldn't understand it
Hmm.
until I actually experienced it in my exam. So the first exam, I felt I couldn't clear it because I was basically giving them answers just like it was in the portal. So I just copy pasted it. I didn't even let the patient speak.
Hmm.
So, which I felt was a reason which I couldn't clear. And second exam, I improved on that, but then I couldn't clear my technical tasks.
Hmm.
So by the third attempt, I understood that the main motto of the thing to clear ADC is you have to address patient's concern and answer the last question that
Hmm.
they have given. I guess that pretty much those two, if you cover, it's more than enough. And all that information is already given in your portal. So it was easy for me to actually connect. So
Mhm.
I basically read everything that was there in your portal, like for every case.
Mhm.
And then when I went there, I just let it free and then made a discussion with the patient just so that I give the patient to ask me questions and I answer that. And I also made sure that I answered the last part of the question. And I also kept in mind which cluster I am
Mhm.
attending, and accordingly I emphasized on those parts. Like if it was information gathering, I mainly emphasized on asking questions
Mhm.
rather than like I just give very brief diagnosis or very brief explanation on things like that.
Mhm.
Similarly, the other two clusters as well.
Okay.
uh, with regards to again technical task, for me, I just followed your videos. I never took any additional classes, but I just followed your videos. And that was pretty much enough for me to understand what actually ADC wants. So, yeah, technical task it was pretty fine for me, like only with your videos. And I used to share my work to you, and you used to give me comments on that, and I worked on it. But in regards to technical OSCE, uh, for me, the problem was with time management, especially with rubber dam and pit and fissure sealants.
Mhm.
So the first exam I couldn't even clear by rubber dam.
Mhm.
I just went halfway, and the clamp popped out, and then I freaked out. So my first attempt went like that. My third attempt, when I had my rubber dam, I well planned it. So my planning was in such a way that I had mentally planned where I have to floss in the clamp. Like I just made what do you say, easy stuff. So wherever there was numbers, like in every clamp there's number, right? Like 13A,
Yeah.
14A. So I just made it a point ki if I have to put floss in one quadrant, I know I should start in the number one. So
Mhm.
I made such kind of thing in my mind so that it makes things easier for me to floss, and I
Mhm.
don't think there to take what instruments I require.
Mhm.
So basically I took that 3 minutes for understanding that and planned it before itself.
Mhm.
If this quadrant comes, then I know where to floss exactly. I won't sit and think, okay, which is the palatal side, sorry,
Mhm.
which is the buccal side. Then I have to search which is the buccal side and then think about flossing it. So I didn't give that much time for that. And I planned the sequence of taking the instruments as well.
Mhm.
I know first I have to take two floss, and then I quickly took two floss. So I had practiced that
Mhm.
several times, like just taking the instrument so that I don't waste time on taking the instrument or analyzing what instruments I need at that point. So that saved me a lot of time actually. And
Mhm.
then with the task, first time I was a bit anxious, so I was shivering and I couldn't really concentrate. But third time when I went, I was relaxed,
Mhm.
and then I took my time,
Mhm.
and luckily I could finish it well before the time ended. Like I had the extra 2 minutes to
Mhm.
check everything.
Mhm.
So this actually worked for me. For me, being calm was
Mhm.
something which helped to
Mhm.
manage with my time. Plus, I didn't waste time on selecting the instruments
Mhm.
and setting my chair as well. So for me, I didn't want to waste time on setting my chair position. So
Mhm.
usually ADC allows us to set your chair during the reading time. So
Mhm.
I took that time to set my chair, and I didn't waste time on selecting the instruments, which gave me good time to do the task in technical OSCE. So similarly, it was with pit and fissure, but rest everything,
Mhm.
usually it's not time taking. We can
Mhm.
finish it. So yes, sir. So
Well, yeah, that's
this.
fine. I'll just cut you here. Starting from the first thing that you said in regards to the communication OS keys.
Mhm.
Yes, of course, the last two lines that the case tells you is the task for your station. A lot of candidates, they don't realize because ADC does not really care how knowledgeable you are. You have a case in front of you, and that's your task for the station, right? So a lot of candidates, they will think, okay, this case, I've got it, I've read the case, but they will not focus on the last two lines of the case, which it actually tells you what you need to do for that case. And that's true for the technical as well, because if you're doing something, you should know what your outcome should be. And the other thing which I have realized, of course, not with you, but in general, since we have other candidates here as well, is that they don't cover everything that is there in the course portal. Now, when we have fabricated a course portal, of course, we have fabricated with a lot of experience, with a lot of successful candidates, years of experience with teaching them. So I had a candidate just 3 days ago. He failed the practical exam, unfortunately, and he failed the technical. He cleared the communication. So he was telling me, Dr. Raza, it will be a good idea if you include the assessment videos for the technical task in the portal. Now, I was asking him that, what do you mean it's a good idea? These videos are already there in the portal. He said, oh, really? I didn't never get a chance to go through them. Now, you understand what I'm trying to say here? I'm trying to say that the candidates, they don't really focus every video, every step that I've done in the demo videos, in the assessment videos. I'm trying to follow the ADC marking rubric. So if you're not serious about that and you are not bothered, that guy was giving the practical exam the second time. So if you're not really bothered in looking at those assessment videos, and there is a separate assessment video for each task of the technical, so that means you have missed roughly around 7 to 8 videos. How is that possible? But yes, then he realized I said, what you can do is just open the portal in front of me, open the task. I think he was asking me about the amalgam task. I said, open the amalgam task and look at the last two videos. What are they about? And then he said, oh, sorry, Dr. Azhar. Yes, these are the assessment videos that you have made according to the ADC marking rubrics. So my reasoning for that is a lot of candidates, even the written exam candidates, they will say, okay, out of 10 files, let me do 6 files and let me skip the remaining 4 files. Now, you can't do that. Yes, with your BDS degree, with your university, you possibly can get through. But with the ADC, because every station, every task, every question, whether it's the written or the practical, is so important because it can be a reason for a pass and a fail. So you can't take it lightly. So first thing, yes, everything that we have in the course portal, every video, every second of the video, everything that I've mentioned, every exam experience session that we have conducted that is there in the portal, every video that you have, every PDF file that you have is there for a reason. All right. If it was not important, we would have not included that. All right. And in regards to your technical that you mentioned, that is very important for someone to assess your work, because I do remember that you did share a lot of tasks for assessment. We do allow the candidates to share tasks with us for assessment, pictures, videos, each task 4 times, so that they are able to know how they are going in regards to the task. But the most important thing is for you to analyze yourself, for you to be convinced, all right, if I replicate something like this on the day of the examiner will pass me for this task. Until you achieve that level of understanding and that level of confidence, it will be very difficult for you to clear that task on the day of the exam. Why? There are multiple reasons why. First of all, when you're practicing at your home setup for the practical exam, you're practicing in the comfort of your home, in the comfort environment of your home. The exam environment is completely different. So if you're not able to achieve something at your home practice, how can you expect to achieve a good outcome on the day of the exam, where the exam environment, the stress is so much more compared to when you're practicing at your home setup? So always make sure to achieve each task according to what the ADC marking rubrics is about. All right. Okay, Dr. Ishra, thank you for that feedback that you have given us. A lot of questions that we get in regards to the practical exam is, how much practice did you do? So can you please answer that question? A lot of candidates do ask how much practice that we need to do. So can you please tell us about your journey and how much practice did you do to prepare for the practical exam?
Um, for my first attempt, I pretty much I took off from my work for almost like a month. I, in fact, left my job. So I practiced my practicals, like technical tasks, for almost one whole month. But yeah, I couldn't clear.
Mhm.
Then again, second attempt, I didn't practice much. Third attempt also, I didn't spend much on that.
Mhm.
Because my first attempt itself, I could actually clear pretty much most of the technical tasks. And
Mhm.
I don't know, I was personally, I was very handy with technical tasks.
Mm-hmm.
So I didn't practice much for my technical task as I practiced for my communication OSCE. Yeah, so I maybe the last time when this attempt when I passed, I just worked hard for maybe 2 weeks continuously for my technical tasks. But then once I understood what I actually have to achieve, uh,
Mm-hmm.
it was easier. I mean, I felt easier in technical tasks.
All right. So, what would you say about home setup? Some candidates say that home setup is required. Some say that you don't really need a home setup. So, what would be your opinion in regards to that?
Well, it is actually very important because we obviously without any practice we cannot sit in the exam. Already that to get used to that environment, exam
Mhm.
environment, it takes some time. So we waste a lot of time just getting used to it. Plus, if we don't practice, and I don't think we'll have enough confidence to
What about
do.
OSCE partner? Like, do you think you need an OSCE partner?
Well, I didn't have one.
So, who did you practice the
So
OSCEs with?
like I used to record it, like you
Mhm.
said. So
Mhm.
I used to record my conversation and
Mhm.
then try to listen to it and see if I actually answered well. This is how I actually did. Maybe at the end, I took. I mean, I just
I think
tried
you
it
had
with one of
sessions
my
with me
friends.
as well for
Yes, sir.
the
The first,
communication OSCE.
yeah, when I gave the,
And
yeah,
we
when I
have
gave the first,
certain recordings as well, presentation videos in the portal that helps the
yeah,
candidate on how you should be answering and how the ADC actually marks you for the communication tasks. All right. Okay,
yeah.
now let's come to the examination day.
Mhm.
You have talked about your journey, your preparation. Thank you for that. Now, the examination day itself, how would you say like experience of the examination day itself? Because preparation is different thing, right? A candidate
Yeah,
who's really well prepared might not be up to the mark on the day of the exam for certain factors which are out of their control. And a
yeah.
candidate who might actually not be very well prepared, but does really well in the exam and clears the exam, because we have seen a lot of those experiences as well. So, what
Mhm.
would you suggest in regards to that?
I would say that examination is a very stressful day. I mean, it is very stressful. And if we try to control stress and do things with patience, and if we are calm, it, I mean, I feel we can actually do well when compared to when you're more stressed. Because my attempt when I failed my technical task, I was very stressed. I didn't condense my amalgam properly. The amalgam fell down, and all these bad events actually spoiled my other tasks as well. So I feel personally stress management and being calm is very important to attend this exam.
And how would you say in regards to the equipment, the materials, the examiner behaviors on the clinical day? Do you think it's a discouraging behavior or a discouraging environment?
No, actually, they are very supportive. What they're happy to help. Like when it comes to clinical OSCEs, I guess since they are patient, that's how they try to behave. But when it comes to technical tasks and OSCEs, they're really helpful. Like they're happy to help actually, and the instruments are also really good. And they how much ever times you ask them, they're happy to help. They're
Mhm.
actually good.
Okay. Now, the other thing that I want to add here, since we are in this question, is that you see all these examiners that you have on the clinical skills day of the exam, they are clinicians in their real life, all right? So they are on a contract basis as ADC examiners. So you see, whenever you have someone presenting a case to them, they will always think with the clinical point of view. They won't think in regards to theoretical point of view. Why? Because a patient who comes to you and he's in pain, he wants a solution for the problem that they are having. The examiners don't care how much knowledge you have in regards to what the patient is suffering from. The top priority is to making sure the patient knows, which of course is the examiner on the day of the exam, know what the problem is and how are you going to help the patient get out of that pain that they're having, whether it's pain, whether it's a swelling, whether it's a cosmetic aesthetic concern, or whether the patient is coming to ask more about a certain treatment option that they would like to get them. So it's always about the clinical point of view that you look at things for why. Now, just imagine, I always tell the candidates during the communication OSCE sessions and the mock OSCEs that we have, just imagine once they are done with the case, and if they don't perform the case really well, I just tell them that imagine that you are the patient, reverse the roles, and imagine you are the patient, and the way that you communicated to me, imagine the dentist communicates in the same way to you. Would you be satisfied? And then the candidate tells me, no, I'm not going to be satisfied. So when I tell them that if you're not going to be satisfied, how do you think the examiner is going to be satisfied? So always think that whatever you say, imagine yourself at the receiving end as a patient. If you think what you conveyed is satisfactory for you as a patient, then it's going to be satisfactory for the examiner. But if you feel, no, I could have done well, I could have added this option, I could have given more clarity in regards to the treatment option that I presented. So if you feel that way, then that's the right way to approach and work on your mistakes. Because if you are not confident that the examiner will pass you because you did not do well, then of course the examiner has more reasons to mark you down, right? So if you feel you made two mistakes or three mistakes, please multiply that by two, and then that is six mistakes that you made, which resulted in a failure in that station and probably the cluster that you had. All right. Okay. Now, Dr. Ishrat, one more thing is that, of course, you know that everyone prepares for this exam, but not everyone passes the exam, right? So the pass rate definitely is very low, no matter what you see on social media or all these Instagram or Facebook posts. The examination pass rate is pretty low, roughly around 10 to 15%. On a very good year, it might be 20%. That's for the practical exam. So, what do you think is that sets apart a pass candidate and a fail candidate? Because you have experienced both. That's why I'm asking you this question.
I couldn't really understand, doctor. Can you ask me
Yeah.
once again?
What I'm trying to say is that every candidate prepares for this exam, right? But not every candidate clears this exam because the pass rate is quite low. So, what do you think, according to your experience, since you have experience of failure as well experience of clearing the exam, what is that sets apart a pass candidate and a fail candidate?
Uh, well, I'm not sure what to answer for this because I myself was in a situation where I was like, I'm not gonna clear this time as well, and but I was in a situation where I was not gonna give up. I'll just try as much as possible. I passed because they have certain criteria to pass, and we can't help it. But the only thing that we can do is
So, do
try
you think
without giving up.
ADC purposely fails candidate?
Well, no,
Hmm.
because they have clearly set a rubric.
Hmm.
They have clearly told what is required for us to pass, and
Hmm.
I feel if we satisfy all those,
Hmm.
they have no reason to fail you actually.
Mark you down, of course. So I will be agreeing with that. ADC never fails a candidate purposely, all right? Whether it's the written exam or the practical exam. Of course, the standards are high, the rubrics are tough, but you will see the candidates not meeting the rubrics, not meeting the task, what the task is expecting from you, and that results in the failure. Whether you are aware of those mistakes or whether you are not aware of those mistakes, that is a different story. But ADC does not fail anyone purposely, whether it's the written exam or the practical exam. And it's like I just earlier said, that it's pretty much obvious. When the candidates share their technical task with me, and in the past when I was doing technical on-site assessments and then the written exam as well, so you see, if you can't do the task well at home, and when you have communication OSCE sessions with me, if you are making three, four mistakes, like I said, multiply that by two for the exam because exam environment is completely different. So if you're making one or two mistakes at home practice or communication OSCE sessions when you have them with me, imagine making a bit more mistakes in the exam day. All right. But because the exam environment is so fast, it's so abrupt, you don't really remember the mistakes that you made because you have to go through 10 stations on clinical day in roughly around 3 to 3.5 hours. So you don't really remember every mistake that you made, but because the ADC examiners are marking you on the iPad on spot for each station, so they realize the mistakes that you made, which you might not know, and you feel that you did really well. But when the results comes out and you fail in that station, and you still can't remember what mistake you made, because it's really hard for candidates to remember what mistakes they made after the exam, because like I said, the exam environment is quite rapid and quite abrupt. You don't get a lot of time to think. All right, Dr. Ishra, thank you for your time. Just last one advice that you would like to give to the future candidates in terms of preparation and the courses.
Uh, for me, regarding to courses, I personally liked only your course because I have been with you from written exam and I'm very comfortable with your portal, and I never took anything extra, just that 1 day class from Dental 101 to get accustomed to how technical OSCE will be. And that is also the only time when I gave my first attempt. But if you follow what Dr. Raza's portal has, everything like from the beginning till the end, just go through all the portal. I feel that's more than enough to pass the exam. Rest again, it depends on how much practice, because it's very subjective person to person, and I feel it depends on every individual. But with regards to source, I feel Raza's portal is more than enough for clearing this exam.
Is there anything that you think we can improve on with the course delivery?
Well, sir, if I would say, then I feel I'm more than happy with it. There's nothing that I would actually tell that you need to improve, because for me, whatever, especially it was with doubts, whatever doubts I had easy access to you, and I used to get answers very quickly, which was very important for me, which actually your portal satisfied. So I don't think there's anything that I would add to improve or something like that.
All right, thank you for that. We always accept criticism as well, if
Mhm.
it's in our favor or not. But thank you for that. So we'll just see if you have any questions. Someone is asking, which set did you get?
Well, I don't know exactly because I never read it like set
Well,
one,
that's a
set two,
good
and
thing that
six.
you
I'm not
did,
sure.
because we don't want candidates to memorize sets and be prepared for everything, right? So if you go with
Yeah.
a memorization mindset, it's very likely that the examiners are going to fail you, because they don't want professors. They want clinicians once they clear the ADC exam, right? Okay, is the change over time of 1 minute enough to give you a break from one station to another? I believe it's 2 minutes, not 1 minute, right?
Actually, now they have changed it, sir. Before it was 2 minutes, but now it's actually 1 minute.
No, 1 minute between the stations?
Yes, sir. 1 minute
So
between the
that one
stations.
minute starts once your 10 minutes is done.
Yes.
Okay. And why did they do that? Already two
I don't
minutes
know.
was less.
Yeah, so actually they tried incorporating it, and during my exam, what happens was there was slight difference in the time, so they used
Mhm.
to somehow manage it, but now it's just 1 minute between
Yeah, they said that
each
they will
station.
implement it by in July, but I didn't know that they're going to implement it so soon. What are your techniques for stress management while you're inside the room?
Uh, well, that's what it's preparation. I guess when regards to, like I told, technical OSCEs, if you're well prepared on what you're supposed to do, you're well planned on what you have to do, then I guess you won't be stressed to manage that. Even with communication OSCEs, if you know what to answer, and if you have a good, discussion with the patient, I guess it's much easier to, lower your stress level.
Can you do other tasks while you wait for the putty to set?
Yeah, you can. I actually did that. I I put my putty index, and I was actually doing other tasks. So you can do that. That's actually a good way to save time
Yeah,
as
you
well.
can do that. You can arrange your setup. You can check the drawers. You can see everything is fine for the next task that you do. So
Yeah.
examiners don't really bother. Please don't be picky about these things. All right. These are the least things that you need to be worried about. Okay. It's the outcome that it matters. It's not how you reach there. Does the slow speed also have water in it? I don't think so. It has water, right?
No, no, it doesn't have so.
How much difference is the case scenario from the scenarios that are there in the portal?
The See, it's the basic. We can't expect everything to be same. The main topics are same. So yeah,
Yes, of
whatever
course,
the
you
actual
should be
scenario is
expecting,
same.
yeah,
Yeah.
you should be expecting, whoever has asked this question, you should be expecting some change because in certain cases you have the X-rays and then you have the clinical pictures. So we have tried to keep it as close to the exam scenarios as possible. But of course, there will be some difference. And at certain times, the ADC adds certain medical conditions to the chart as well. So roughly, I would say around 90 to 95% of the cases are going to be the same, but there will be some variation, all right? Because no one takes picture on the day of the exam. These cases that we have fabricated is with experience from thousands of candidates who have sat the exam. So of course, there will be some minor variation, but the theme, the main core thing is going to be the same, all right? What do you normally write in the paper in the initial 3 minutes? Do you have enough time to go through MIMS and still makes notes? Are the X-rays clear? Do you have time to go through pair charts and interpret the data?
Well, we have to make time for it because that's very important.
Mhm.
Uh, Regarding to writing notes, yes, I do because it makes things easier, especially what is very important. I write it down, especially these antibiotics, all these stuffs. I make sure I write it down because sometimes during conversation we tend to forget.
Mhm.
So these things are very important, which can mark you completely down. So I write the
What
main
about
stuff
the
down.
MIMS? I don't think so. MIMS is there in
Yeah,
every station. It's just probably in one or two station out of the 70 cases that we have in the portal, isn't it?
yes, sir. And I don't think we'll have enough time to check MIMS, but only when I personally only did that only with my technical OSCE during my LA task. But
Yeah, that's very important because the examiner is looking at you, right?
yeah,
If you don't
but
check MIMS in that station, it's a straight fail.
hmm.
And some
And
candidates don't even know where the MIMS is because they are so stressed, but that's normal. So make sure that you look for the MIMS because you have 3 minutes. In technical OSCEs, case reading time is not really the main problem because
yeah,
you will know what the case is about. They will give you a lengthy case and then at the end they will say isolate tooth number one or two, one for root canal treatment, right?
hmm.
So the case reading is not that important in technical OSCEs as it is for the communication OSCEs. Are the X-rays clear?
Yeah, it is. Of course, it's very clear.
Do you need to say things loud as you are going your skilled OSCEs except CPR and syncope? I don't think so. You should, right?
No, you don't have to.
Yeah. CPR and syncope, you have to tell the patient because the examiner, because the examiner is guiding you. Because, for example, when you are checking, let's say danger, the examiner will say no danger. When you're checking airway, the examiner will say airway is clear. When you're checking breathing and pulse, the examiner will tell you the pulse is there, the breathing is there. So why you need to say in CPR and syncope is because these are mannequins, right? So the mannequin does not show any response. The mannequin doesn't have breathing or pulse. So the examiner uh, replicates the behavior of the mannequin and tells you, yes, the breathing is there, the pulse is there. All right. Doc, what was your sequence for the technical task? How did you manage your time during technical day?
So actually, I went with a task which actually would take less time. So I took amalgam as my first task because I
Mhm.
could finish it within 40 minutes. Because
Mhm.
anyways, the amalgam sets at a
Don't say
particular
that candidates will get angry with you.
time.
Yeah. All right. Continue.
Yeah, so actually the amalgam sets at a particular time anyway, so it's gonna take only 40-45 minutes. So and I felt with amalgam task, condensation was a key thing. If you
Mhm.
condense properly, pretty much I guess the task would go really well. After that, I did my crown preparation and my provisional crown in my first half. And the
Mhm.
second half, I had enough time. Since I
Mhm.
finished all the major tasks, I had enough time. So I took my composite, endo, and cavity preparation. But cavity preparation, I made it a first task in my second
Mhm.
half because
Okay.
I didn't want to rush through my cavity preparation because sometimes we might extend.
Well, that's
So
true.
that
That's
was
one way of, sorry to interrupt. That's one way of doing things. In my opinion, if you ask me, I think it doesn't really matter which task you start with because at the end of the day, you are going to make sure that all the six tasks are done. So what you start with does not really make a difference, but starting with something that you are more confident gives you more happiness, I would say, as you go along on the day. So it doesn't really make a difference if you start with amalgam or crown preparation or if you start with composite restoration. So it doesn't make a difference. My strategy, what I used to implement, was doing a cluster. I divided the exam into 2 days, first half into two halves. The first half was preparation, get done with all preparation, crown preparation, caries preparation, endo preparation. The second half was restoration. So I used to start with provisional crown, then the composite restoration, and the last thing I did was amalgam. But please remember, that's one way of doing things. You don't need to follow me in regards to this because, like I said, you need to finish all the 6 tasks. The sequence does not matter, the outcome matters. All right. I just did it because I wanted to keep things simple. All right. And I knew I had a lot of time. I had 1 hour, 20 minutes at the end of the exam. And I really did not do much. I was just sitting around and because I had done everything by then. Okay. But again, it depends on what you are confident with, what you are comfortable with. It does not make a difference on which task you start. I would say it's better to be inclined towards either a restoration like an amalgam or a preparation like a crown preparation because these things do take time. All right, especially the crown preparation. So it's better to be inclined towards that. But again, it shouldn't be your preference. You can see what works for you. Every candidate that we have is totally different from the other candidate. No candidates, two candidates are the same in the practical journey. So see what suits you and work your way in regards to that. Is on-site mock helpful or just mock at home is sufficient? I believe she's asking about the technical tasks.
Uh, for me, at home worked well than any on-site course. Yeah, I feel all the videos that is there in the portal is more than enough to understand. Once we understand what is actually required, and it's very easy to,
I believe
learn.
I'll add to this is when you're doing a mock at home, please try to do the mock with PPE. Will you agree with that, Dr.
Yes,
Ish?
sir. Yes, sir. Yes, definitely. Because you
Because
will get
when,
used to it.
yeah,
Yeah, and it won't take much time in exam for you to think, oh, should I wear this or should I wear that? So it makes things more comfortable when you're doing it. I mean, practicing with PP at home, and it makes
how
things
long
easier.
did you wait for the practical results to come out? I believe it's 4 to 6 weeks, but that cannot be the same every time. Sometimes they release it in 4 weeks, sometimes they can go up to 8 weeks. All right. What questions were asked from you in OSCEs?
Um, I had rubber dam, fissure sealants, LA,
I
radiograph,
think he
and
means the
yeah,
communication OSCEs. Yeah.
technical OSCE. Okay, they asked me technical. Sorry, sir. Is it technical OSCE?
What questions were asked from you in OSCEs? So it's basically the examiner asking you question in the communication OSCEs, right?
Oh, okay. I can't really
Well,
say
I
what.
don't think so. That's an appropriate question as such because you can't just ask or expect the candidate to remember. But I would rephrase this question. Were the questions that were asked easy to answer?
Uh, Actually, few were when we emphasize the topic, I guess they go deep into it. One of the examiners, they asked me when when I told, the guidelines have changed for antibiotic prophylaxis for joint surgery. They asked me when was the guidelines changed and do you know about it and stuff like that. So
Hmm.
if you go deep into it, some examiners, they ask more questions regarding it.
Hmm.
Uh, but otherwise, it was pretty simple. Like, we just have to convince them. This is what I
In
felt.
cavity preparation task, did you get a connected cavity? What was it, MO or M plus O?
It was a connected cavity.
It was a
It was
connected. So did you experience a cavity that is not connected? I think that's pretty much rare, right?
yes.
I think it's 3,5-DO that you get usually, which is not connected, but that's also rare. You have a connected version for that as well. But again, you can't just predict because ADC does not tell you whether it's going to be connect or not. You have to make your clinical judgment. We have a video in the portal that tells you to connect or not in the caries preparation task. All right.
Yeah.
All right. Thank you, Dr. Ishrat, and hope everything is going to go great for you. And once again, congratulations. I will see the other candidates when they are available. Maybe we can have an exam experience sessions with them as well, or maybe I can ask them to provide a video to help the candidates, which I can post in the portal or the group. All right. Thank you so
Sure.
much, Dr. Ishrat. Wish you all the best. If you need any help further from me, you know how to find me and you know where to message me. All right.
Yes. Thank you so
Thank you.
much, sir.
Thank you. Thank you. Have a good evening. Take care.